Assalamu alaikum. My name is Khaled Hammoudeh. In this video, I'm going to be explaining Dr. Atif's lecture, which was coronary circulation, and I'm going to be covering his important points, not everything that he mentioned. And at the end, I've gathered up everything that you need to know for the TBL tomorrow. Now, starting off with myocardial infarction. Before I get into how does the pain come and how does the pain happen in the first place, I wanted to explain what's myocardial infarction. Why is it in the first place? In simple terms, myocardial infarction is a heart attack. Everyone knows myocardial infarction as a heart attack, but since now we're becoming doctors, we need to know as myocardial infarction. Now, a question that the doctor asked was, how does the person feel pain in his left arm as well as in his chest, even though the issue is coming from the heart itself only? This happens from something we call referred pain, where signals are coming from your T1 to T5 spinal segments of the left arm, as well as coming from your heart, and they go from a shared pathway between them. So once it reaches the brain won't know if the pain is coming from the heart or the left arm. So you're gonna start feeling pain in your chest and your left arm. Now, coronary angiography. Before I start explaining what do we use angiography for, I want to explain the word angiography itself. Now, if you break up the word into two, angio means vessels, where graphy means imaging. So basically, angiography is the imaging of the vessels, and since it's coronary angiography, that means it's the vessels of the heart. Now, how do you get the imaging of the heart? How do you get this imaging, as you can see here in this picture and in this picture here? So basically, what happens, you insert the dye in your bloodstream, in your artery pathway. However, you don't go to either like the ascending aorta or any major vessels, because that's dangerous. That's dangerous for the heart. So you enter from a safer pathway and an easier pathway, which is the femoral artery or the radial artery. And we're going to be explaining the left and the right coronary artery later. Now, in this slide, all I want you guys to know is the circle here is the base of the heart, and the loop is being the apex of the heart. So, the doctor used this to explain how the coronary arteries come from the right and left artery, but I want to use this picture to explain it better, because I feel like it's like more realistic and you can imagine it better than from the circle and the loop. Now, here, obviously, from the right side of the heart, you have the right coronary artery. Now, in 75% of the humans, you'll have the pia. The pia is what comes from the back of the heart. So you'll have the pia and the right marginal branches. Those are the two major branches you need to know of the right coronary artery. However, for the left coronary artery, you need to know LAD and circumflex. You could also have pia, but that's for like a very low amount of people, which is I think 10 to 15% of the population. Now, the angiography. What you need to know in this angiography, in right coronary artery, once you get this picture, because we might not even get if it's right coronary artery or not, if you see an L-shaped, that's always going to be right coronary artery. Whenever you see right coronary artery, there's going to be an L-shaped. You'll always see an L-shaped. Now, all of these I'd recommend memorizing. However, you'll have two high-yield ones, which are more likely to come than the rest. You'll have 2 being the right coronary artery, obviously, and 4 being pia. As you can see here, pia, and this comes from the back of the heart. This is behind the heart. This is not anterior. It's not in the anterior surface. It's in the posterior surface of the heart. Now we have left coronary artery. In left coronary artery, rather than an L-shaped, you'll have a claw shape. You'll have a claw shape, and it's in a different angle of the heart, so you can only see left coronary arteries. Again, you need to know all of these, but there's two more ones that are more likely to come, which is LAD. And LAD here is the one you could say on the right side. Actually, no, this is a different angle of the heart, so this is going to be the left side, and this is going to be the right side. So at the right side is the circumflex, and the left side is going to be the LAD. These two are really important, and you really need to know them, because they're more likely to come. I also wanted to mention 12 here is the marginal not 12. I'm sorry, 11. The marginal branch, which is also another major artery for the left coronary artery. Now, coming to left and right heart dominance. For me to explain this better, I'll use the analogy that the doctor used as Pia being the princess of the heart. Whichever the right or the left coronary artery has Pia is going to be the dominant side. So most people have Pia with the right coronary artery, which makes them right dominant, which makes them a right-hearted dominant. However, some people, but a lower percentage of people, they're going to have Pia connected with their left coronary artery, which makes them left-hearted people. So, however, I wanted to mention a fact which was mentioned in the previous years, and I think it's a pretty important fact, even though Dr. Atif, I'm pretty sure, did not mention it. In the interventricular septum, we have two arteries innervating it. We have LAD, which was from the left coronary artery, and we have Pia. Pia could be from the right or the left. Now let's use an example where we have a patient who's right-hearted. If the patient is right-hearted and he has an issue with his left coronary artery, only two-thirds of his interventricular septum is going to be affected, because 1/3 comes from the right coronary artery, which is from Pia. However, if the person is left-hearted and he has an issue with his left coronary artery, then the whole interventricular septum is going to be affected, because rather than 2/3 of the heart being affected, it's going to be all of them, the whole interventricular septum, because in that case, Pia and LAD are affected, because in a left-hearted person, Pia is going to be included with the left coronary artery. I hope I explained that good. Now, in this image, it shows how the arteries work. So here, okay, you'll have LAD. Okay, actually, this picture is good to explain the interventricular septum point that I just made. You can see here LAD, it takes up 2/3 of the interventricular septum, where Pia takes 1/3 of the interventricular septum. So, as we mentioned earlier, and I'll repeat the point in case I did not explain it well the first time. If the interventricular septum, okay, is affected by 2/3 and not 1/3, that means the person is right-hearted, because that means Pia is connected with the right coronary artery, which is right here, which means we still have 1/3 still being supplied with blood from Pia. However, if the person is left-hearted, that means both Pia and LAD are not going to be supplying the interventricular septum. And yeah. Now, let's talk about the solutions for atherosclerosis. If you don't know what's atherosclerosis is the blocking in the artery. There's a blocking in the pathway for blood. And there's two ways to solve this. The first one is using an angioplasty. So basically what we use here, we have a catheter. We innervate it through either the femoral or the radial, as we mentioned earlier for the angiography, because they're the easier ones to go to the pathway. And once we reach the blocking of the heart of the pathway, we'll have a balloon in this catheter which is gonna open and expand. It's gonna remove the the cholesterol that's blocking the pathway. However, we don't stop there because after we remove the balloon, it's gonna regrow. The cholesterol is gonna rebuild up in that area. So we're gonna add a stent. This stent makes sure and it keeps the artery open and the blocking doesn't happen again. Another way to deal with atherosclerosis is by coronary artery bypass. However, we use this in a more severe case, as in angioplasty. It's not that severe. In this case, we use it when there's too many atherosclerosis in the pathway, where there's where you need to have another pathway for the blood for it to go. And you take them from two veins, which was mentioned here, either by the great saphenous vein or the interthoracic vein, interthoracic artery, I'm sorry. Now, lastly, the doctor talked about the cardiac veins. Now, the cardiac veins of the heart, okay, I want you guys to know that they all the veins of the heart, they all meet up at the coronary sinus. The coronary sinus, as you can see here, this is an anterior view of the heart, which means the coronary sinus is at the back of the heart. It's at the posterior part of the heart. And you have three main veins coming to them. You have the great cardiac vein, the middle cardiac vein, and the small cardiac vein. You need to memorize these three veins because they're really important. And here they're mentioned again. You have the great cardiac vein, the middle cardiac vein, the small cardiac vein. You also have the posterior and small oblique vein. They're not that high yield, but you also need to know them. They all meet up at the coronary sinus where they start filling in the heart. Now, I wanted to talk about conduction system of the blood supply. The doctor mentioned this at the end, but before we get into it, I want to explain the word ischemia. So what does ischemia mean? Ischemia means when blood is not reaching a certain part of the body. That means it's not going to be receiving oxygen or nutrients. This leads to ischemia. So this is just, I wanted to explain ischemia in case someone didn't understand it. So the conduction system of the blood supply, if you guys remember, conduction system was the SA node, AV node, then we go to the bundle of Hess, then the septum, and then we go to the Purkinje fibers. So our blood supply helps also supplying this part of our conduction system. And what you need to know, LAD, or you can also say the left coronary artery, it supplies the distal part of the conduction system, being the septum, the Purkinje fibers, and the bundle of Hess. Where the right coronary artery, they supply the SA node and the AV node. But for the conduction system, it's not the same for everyone. It could be different for other people, but this is the more likely cases. And again here, I wanted to explain. In the right coronary artery, you can see it helps supply the proximal part, which is the SA node and the AV node. And as you can see here, for LAD, it's supplying the bundle of Hess, or the AV bundle of Hess, the septums, and the right and left bundle branches. Now, I wanted to add at the end here the TBL material that we're going to have tomorrow, because these are really important and they're more likely to come in our TBL tomorrow. We have the right coronary artery. I'll read them for you, and I think if you take the time to memorize this, you'll be fine for tomorrow's TBL in this subject. The right coronary artery and the left coronary artery, they both come from the ascending aorta. And that's something that you need to know, and we've also had it in our last OSPE. The major branches coming from the right coronary artery are the right marginal arteries, and 70% of the time PIA. And then the area of supply, it supplies the right atrium, most of the right ventricle, part of the left ventricle, and the SA and the AV node. This is also important to know. It also supplies 1/3 of the interventricular septum of the heart in a right dominant person. In the left coronary artery, it also comes from the ascending aorta. The major branches of the left coronary artery are LAD and circumflex. 10% of the time, it's PIA in a left dominant heart person. Area of supply, you have the left atrium this time, most of the left ventricle, a part of the right ventricle, and 40% of the population is the SA node. You also have 2/3 of the interventricular septum also innervated by the left coronary artery in a right dominant person. However, if it's the left dominant person, then it's going to be the whole interventricular septum. And yeah, thank you.